to shut down that window.
Right, because it's going to stream through if you don't.
Yeah. So we don't get some feedback.
It'll pop up in a second.
Shut down that window.
There you go. Right, because it's
okay.
Perfect.
Yeah.
All right. So you're good with all that stuff?
I think we're getting better at this. So, okay, I've got it on YouTube and we're ready to go.
All right, I'm taking back the host.
Okay.
Okay, go ahead.
Great. Okay, so again, I'm Rick Olderman, I'm a physical therapist, so I'm here to answer your questions. If anyone wants to start off with a question, feel free to ask it, and Alan will unmute you. So an easy way to do this is at the bottom of your Zoom screen, you'll see a reactions button, and if you hit the raise your hand button, Alan will call on you, and then you can put down your hand after he calls on you. How's that? So anyone with a question? And if not, I've got a question that someone else sent me. So feel free to chime in.
Okay, so Rick, just real quick. So Jean has a question. She says she can't stay long, but
okay,
if she does want to speak, I'll ask her.
Let's go, Jean.
See if she has a specific question.
Hi, yeah, my question was about, I've had so much physical therapy for different things, but I was just recently, told I was immobile, and now I learned that immobility is a thing with the hips. I'm finding some relief with eccentrics. I don't know if the classical stretch eccentrics.
I'm familiar with it. I'm not specifically familiar with it, though.
Right. Because what happened was, like, my first knee surgery when I was, knee injury was 15, 16. And, I got afraid to bend my knees, and I did a lot of swimming, and I lost a lot of mobility in my hips and knees and ankles, and, and a lot of pain. And I had thought at one point I would need a hip replacement, but I'm without pain now. And
great.
From getting out of it. So I don't know if you have any other advice for what would you advise for immobility?
Yeah. So, Jean, what do you find? Is there something specific about the eccentrics that you're doing that you think is in particular helping you?
Well, I just do it. I don't do it in her full form. I couldn't possibly. I think it's bending the knees. Just because every workout you're just slightly even bend your knees. She bends them more, and just that thing for 20 minutes is like strengthening my legs for standing.
Yes.
And,
okay. I can speak a little bit to that. If you feel that bending your knees has been helpful, let's go deeper into that. Okay.
Okay.
All right. So I've got my little skeleton here. One of the most common problems I see in the clinic, and especially in terms of hip pain, is something called anterior femoral glide syndrome. And it means that instead of the femur head just pivoting in the hip socket like this, it's sliding forward and pivoting. And that will cause groin pain. It'll cause lateral hip pain because it creates bursitis in the side. It'll cause piriformis pain. It's often diagnosed as arthritic pain. And while all of those issues may be present, it's the movement of the hip bone in the socket that's irritating all of these tissues. So the reason that happens, Jean, is because, and I don't know if this is happening to you, but it likely is because the butt muscle attaches to the back of the sacrum like this and attaches into the hip socket. So when the butt muscle is working correctly, it contracts when we walk to create a pivot point for the hip bone. All right. When the butt isn't working, that's when all the sloppiness happens. Okay. Right. So what does this have to do with bending the knees? So when we lock the knees, when we stand, it turns off the butt muscle. If we do that over time, then we start to get sloppiness in the hip, and it causes lots of hip pain. So when you tell me that you're bending your knees is helping, my guess is that the bending the knees is helping you starting to turn on your butt muscles. And this is especially critical when standing, because that's when they're supposed to be working the most, is when we're walking. So my advice to you would be maybe to extend, take that softness in your knees that you're finding, and it doesn't have to be this like a squat. It just needs to be an unlocking of the knees. And if you can start walking with your knees unlocked, you'll have a better chance of turning on your butt muscles, which will correct the femoral glide issue. And it's a miracle for a lot of people. And so that would be my general comment about what you've said about what's helped you.
Great.
Does that
Thank
make
you.
sense?
I think you're right on. I have very weak glutes.
Oh,
And
okay.
what happened was I was just able to start walking because of doing this program. And I'm like, wow, my knees are a little bent. I didn't even know they were locked. Before I didn't even
Yes.
know they were locked.
Most
It's been
people don't.
really 50 years since my surgery.
Yes.
So it just was a bad pattern.
Yes. And most people aren't aware that they're locking their knees. And so one of the tests I have them do is I have them stand up and I have them look at a picture on the wall for 30 seconds. And I ask them to tell me about that picture. And then I'm watching their knees the whole time, because then they're distracted, right? They don't know what I'm looking at. Tell me what you see in that picture. And it's like well, here's the picture right there. You can see it on the wall. All right. It's kind of a little abstract. So anyway, I watch their knees, and as they stand up, their knees go back further and further into lock. And by the time they're done talking to me for 30 seconds, the knees are locked and they are not aware of it.
Wow.
And that's when I show them what they're doing and how that relates to all of this stuff.
Wow.
By the way, this leads to a lot of knee pain too. Do you have knee pain? Just hip?
No, I ended up with having surgery in one ankle. Then I had posterior tibial tendonitis in the other ankle. That's just before I got the thing. And then I've been going to Stretch Lab, which really helped because I was firing my hamstrings. I had real hamstring dominance over my glutes because I have really
Exactly.
My whole family, no glutes.
Yes. Yeah.
So this started when I first saw her one exercise. She did the ankles. Then I went for a walk. I'm like, oh yeah, I haven't used my ankles. I don't know.
Right. So I'm going to go a little deeper into that connection too then. Okay. Because you're exactly right. So when the glutes don't fire, the hamstrings are the ones that are doing most of the generation of, it's the hamstrings or the back. And so it creates, maybe chronic hamstring issues or back issues. So if you can imagine, if the knees are locked, then what's happening to the calf and soleus muscles down here is that they become shorter. All right. So then that's when posterior tibialis and all of those other kinds of plantar fasciitis, all sorts of things like that happen, because this knee locking is shortening the whole complex.
Right.
So once you start unlocking your knee, now the ankle gets to bend and the calf and soleus have to lengthen in order to walk with a softer knee. And that's a natural way of lengthening the calf and soleus rather than stretching, which is more of an unnatural way.
Right.
All right. Great. Does that make sense?
100%.
Okay. So if I were you, since unlocking the knees is already giving you results, I would double down on butt strengthening exercises. And the one that we use is one where you get on your elbows and knees and you lift up a leg and you just pump your leg up and down like this. Oh, okay. I don't like weight bearing butt exercises because unless it's a walking exercise of some sort, because like squats don't train the butt to work in the way that we use the butt. And so there's not a translation into function.
Right.
The elbows and knees one connects your brain to the butt better because it's isolating that. There's no confusing messages coming from elsewhere in the body. It's just the butt. And so there's a better connection happening there. And that's why it's a little superior, I feel.
Okay, great. Well, thank you.
My pleasure, Gene. Thanks for your comment and question.
Thanks.
Yeah. Have a good night.
Thanks. I'll hang up a little bit, but I'm exhausted. I was up last night.
Okay.
All right, Rick, at the moment, we don't have another question coming through.
Okay. If someone doesn't have a question, I have something sent in by someone else. This is a shoulder question. Oh, looks like Adrian has one or someone else.
Yeah, let me grab that real quick. So I'll unmute Adrian first.
Okay. It's like Jeopardy, Christina. You just missed the buzzer, right? We'll get you next.
Thank you.
So Adrian should be unmuted now.
Hi, Adrian.
Hello.
How are you?
Well, right now I'm not hurting.
Great, my job is done.
But I have a question for you.
Oh, okay.
My back pain goes from side to side, up and down, no pattern. If I sit down for 15 minutes, there's no pain. But then if I get up and walk again, there's pain. The doctors and the physical therapists are trying their best, but there's no relief from the pain.
All right. So you want to know what I think about that?
Correct.
Okay, I have a really good answer for you, and I'm very hopeful for you. So this comes down to how a lot of medical practitioners are trained. We're trained, if you have back pain, we're going to look at the back, maybe the pelvis. But there are other things that are influencing the back, the arms, the legs, all sorts of things that are influencing the back. And I bet you they just haven't looked big enough for you. So what I would guess, Adrian, and answer me this, if you lie on your back and bring your knees to your chest, I bet that feels good for your back.
Sir.
You there? Does it?
Yeah.
Yeah. Okay. And then I bet if your legs were straight, oh, look at that. That leg just came off. I bet if your legs are straight, that hurts your back more if you're lying down.
Okay.
Okay. You can test it right now if you want to. But anyway, what's happening is when your legs are straightening, your back is becoming more arched. And that's what's happening when you're standing. When you're sitting in a chair, your hip is bent like this, and it allows your back to flex more and become flatter. And that feels better for your back. When you stand up, you'll notice that your back is more arched. Does that make sense?
Yes, sir.
That's what's hurting your back. So what we have to do is solve the reason why your back is arching when you're standing. The most common problem, Adrian, and do you sit a lot, by the way?
Sir.
Do you sit a lot during the day?
Yes, sir.
Okay. So if you sit a lot during the day, I'm putting this skeleton together while we're talking. If you're sitting a lot during the day, what's happening is that your thigh muscles, I bet, are becoming tight. And I'm going to show you what I'm talking about. There are 3 large thigh muscles in the front of the leg here. This is the front of the skeleton. If you can't see, this is the front. All right, there's 3 large muscles that are thigh muscles that attach into this pelvic bone right here. When you're sitting down, those thigh muscles are relaxed because they're shortened. But when you stand up, you're forcing them to lengthen. And they attach that pelvis there. And what they're doing is they're tilting that pelvis forward. Can you see that, Adrian?
Yes, sir.
Okay, so it's tilting the pelvis forward and causing the back to arch more. Does that make sense?
Yes, sir.
Okay, so there's a stretch for this. And it's one of the featured stretches in my back pain program. But basically what you're going to do is you're going to lie down. Do you have a firm surface or something that you can lie down on?
Yes, sir. I can lie on the floor.
Oh, well, it's going to need to be off the floor, like maybe your bed or kitchen countertop or dining room table, something like that.
Okay.
Okay, so what you're going to do is you're going to lie down. You're going to hold both knees with your hands, and you're going to hug your knees to your chest, and that should feel really good for your back.
Yeah.
Then you're
that's one of the exercises that the physical therapist is having me to do.
Right, but it's not really doing anything. It's only giving you temporary relief. It's not fixing anything, right? So you're going to bring both knees to your chest. That's going to feel really good. You're going to hold on to one knee, all right, with both of your hands, and you're going to lower the other leg. And I'm going to try and make this so that you can see this. Anyway, let me do it off the edge of the table here. All right, can you see that? Can you see that one leg is dropping over the edge of the table?
Yes, sir.
And the other knee is up at the chest. You see that?
Yes, sir.
Okay, that's the stretch. You're going to hold on to that knee with both hands because that's protecting your back. I bet, Adrian, when you do this, you're going to feel a tremendous stretch in this thigh of this leg that's going down. And I bet even that your leg probably won't even be able to touch the table. And what I would encourage you to do is stretch both sides, both legs, for about a minute each, twice. Now, you may not be very comfortable with that because I bet you those muscles are super tight on you. But if you stretch it for 5 minutes and get up, you should feel a significant difference in your back pain right then and there.
Okay.
And if you do, you know exactly what you need to be doing. Does that make sense?
Yes, sir.
Okay. So there are other things that you could be doing, but this is the one that's probably going to get you out of the pain the fastest. And it'll kind of, and you can tell your therapist and your doctor or whoever, hey, this stretch really helped my back. And they'll say, oh, okay, well, I'll help you with that. And so they'll help you with that stretch and go deeper into it if you want to. And hopefully they'll start to look at other things other than just the back and the pelvis on further down the legs that need to be solved. Because I bet you that's what's going on with you. But I would start with that thigh stretch. It should be quick and dirty, easy stretch, immediate results.
Thank you, sir.
My pleasure, Adrian, and thanks for joining me.
Okay, so now we have Christina.
Christina has been so patient.
She has.
Hi, Christina.
I might have muted her. She should be there.
Well, yeah, her mute is on still. There we go.
Okay. Hi, how are you doing?
Good. How are you?
I'm good. We spoke a couple of weeks back. I don't know if
I
you
remember.
Okay, great. I did what you suggested. I taped the arches of my feet,
Oh, okay.
and the results were kind of dramatic.
Uh-huh.
I felt a lot of heat in my legs,
Uh-huh.
my feet, and the next day after I taped them, I had like a horizontal bruise between the femur and what is below the femur.
The femur?
Yeah, that's how we say it in Canada.
Oh, okay. French.
It was between the femur and the tibia. I had like
So
this
at the knee, you're saying?
Yeah, right at the knee, like this
Okay.
horizontal bruise right in that space.
Okay.
So my feet are still taped. Occasionally, I made a drawing for you. I had X-rays taken since we talked.
Yeah.
And this is like can you see it?
Not quite. It's kind oh, there's a little bit. Yeah. I see two.
There we go.
Yeah.
There we go. Okay.
Okay.
Like two legs. Like,
Yes.
okay, so here's the femur and the tibia. This is where the pain is on that leg. And this leg looks good, like the space in between. But this leg was like this, like the space was smaller on the inside of the knee.
Right.
But the pain is on the outside of the knee, but not all the
Yes.
time. Just like a shooting pain when I
Yes.
make a side or a twisting movement. So I'm not sure what to do next.
Okay. So the tape, so is that the original pain that you were having, Christina? Or I can't remember why we
Yeah.
talked last time.
No, that's what we talked about.
Yeah. So that's the pain that we talked about last time, right?
The same one.
Okay.
Yes.
So you taped the foot and ankle and you taped the arch up, right? Is that the taping
Yeah.
technique you did? Okay. The one that's in that foot and ankle?
Exactly the way it is. Yeah.
Okay, great.
Yeah.
So when
On
you
your video.
stood on that tape, after you taped it up, did it feel like your arch was sitting higher?
Yes, I could feel the resistance against the tape.
Yes. And so it felt like it was lifting the arch up.
Yes.
Okay. Okay. So now the next question is, a lot of people, when they tape their arch up, they think that they need to be walking on the outsides of their feet because that's where the tape is taking them.
Mm-hmm.
Were you doing that?
I was just walking normally.
Walking normally. Okay.
Yeah.
All right.
Yeah.
So tape and so tell me a little bit more about that heat that you were feeling in your leg. That's an unusual symptom.
It was in the shin and into the feet.
In the front of the shin?
The whole shin, the whole thing.
The whole shin. Okay. So that is, go ahead.
I've done a lot of Qigong.
Okay.
So I'm accustomed to moving the Qi in my body. So this is not an unfamiliar sensation,
Oh, okay.
but I think it was related to the tape. I think it was.
Probably.
Yeah.
Yeah. Yeah. Well, that's unfamiliar to me.
Okay.
I'm
Okay.
glad it's not unfamiliar to you. So anyway, so when you lift up the arch like this, what I'm wondering is, I mean, the distribution of the heat that you're talking about
Yeah.
is in the muscle group called the anterior tibialis. And when I hear something feels heat, I think over recruitment.
What does that mean?
It means that you're overusing it in some way. So the anterior tibialis, what it does is it lifts the foot up like this, so that when we're moving our foot through space to take our next step, it's the anterior tibialis that's lifting the toes up in order to advance our step. So I wonder if somehow taping that caused you to overly activate that anterior tibialis. I'm not sure. That's a little strange. How many days did you leave on the tape?
It's still on.
How many days have you had it?
Over a week.
And how long did that heat stay around?
Less than a day.
Okay.
Now it's gone.
Now it's gone. But the pain in the side of your knee is still there.
Yeah.
Okay. Are you in shorts by chance? Can I just see what your knees look like?
Unfortunately not. Oh, ow.
Oh,
Oh, see, this is what I mean, like when I try to move. Oh, boy. Okay, wait a second. You want to see what it looks like?
yes. So when that hurt there just now, Christina, was that hurting in that red muscle zone? Okay, got it.
A little bit higher. It hurt a little bit higher.
I just need to see your knee. Well, I would like to see you standing though. Can you tilt your screen down so I can just see you standing?
Let me put it over here.
Yeah, I just need to see what's happening when you're standing. And I'd like to see your other one too.
I compare and contrast.
Yeah.
You could see the bruise was right here.
Yes. Okay. And then I can't tell with your black socks on. Do you have really flat feet? Yeah, you can take those off if you want. Oh, look at that taping job that you've got. Nice.
Impressive, huh?
Yeah, it is. It looks exactly correct.
Yeah, it took me a while to figure it out, but after a few practices, I got it.
All right. Let's see that. Oh, your feet aren't terribly flat.
They would be like this ordinarily.
Okay. All right.
Like this because of the tape.
Yeah. And is your right knee swollen?
I don't think it is. My
The
knees
right
are
leg looks
back.
bigger to me than the left,
Really?
but I may be mistaken.
In here, maybe. In this area. That's something.
Okay. Okay, we're going to do one last test. One last test. Can you lie down on the floor with your head away from your camera?
Okay, so with
Feet towards us.
Okay,
Feet
now
towards
you're-
us, and you're going to be on your stomach.
You're asking a lot of me because
I know.
there's
I
no way
know.
I can get down on the floor.
Well, oh, really? Okay.
So
Okay, so let me just talk you through this. Oh, we can go to your
we can
bedroom.
go
or
to
something
the
like that.
bedroom.
Okay.
So you want me,
To lie face down with the camera facing your feet.
okay.
Your head will be moving away from the camera.
How am I going to do this? Okay. So can
There you go.
really
Roll over on your tummy. Tilt the
lower-
camera. There you go. Perfect.
Want me on my stomach?
On your stomach, please.
Okay, wait. I didn't
I
know.
need to
this
see
was gonna
something.
Require such athletic
I
prowess.
know. You didn't know what you were getting into.
Okay, wait. All right.
Okay, now I would like you to bend both of your knees.
Okay, now this
Okay,
one
now
doesn't
let your
bend
feet-
as much.
I'm sorry?
This one does not bend as much,
Okay,
but I. this is
yes,
supposed to
that
be-
makes sense. Okay, that's the one that with the thinner space in the knee, right?
Yes.
Yeah. Okay, now let both of your feet fall to the outside.
Like this.
Yeah. Now let both of your feet fall to the inside.
I don't know how
Is-
you mean that.
Well, you go ahead and straighten one of the legs so the other leg can fall completely to the inside.
Oh, I see. Whoa, let me.
Yes. Do you see the difference between the motion of both of those legs?
Yes.
Do you see how going to the outside, you have almost no motion, and going to the inside, you have a lot of motion?
Yes.
All right, you have two retroverted femurs.
What does that mean?
All right, so the shape of your thigh bone is such that it's twisted outward. Okay? So when you were standing and facing me in your kitchen,
Yes.
your feet were pointed forward. Okay?
Yeah.
So that's not right for someone with retroverted femurs. When you have retroverted femurs, your thigh bone is twisted to the outside. If your feet are turned inside, then you're unnaturally internally rotating your leg. And torque is created at the foot, knee, or hip.
Okay.
Since you have an arthritic knee, that may be where you're feeling it the most. And that's why you're feeling that muscle burning on the outside of the knee. I wonder, Christina, if you started walking with your feet turned out maybe 2 to 5 degrees and standing like that, and when you sit down, let your knees fall apart instead of together.
Mm-hmm.
All right. If you do all of those things, I wonder if your pain would change.
Okay.
Okay. We're gonna go with it based on the shape of your thigh bones. We're gonna see if you're creating excessive torque through your lower body system because your feet are pointed in the wrong direction.
So you want me to walk with my feet turned out a little bit, and when I sit down, the same thing, so that the knees are also turned out a little
Correct.
bit.
Yeah. I want you to stand like that too.
Okay.
All right. So let's do a little experiment. Stand up right now.
Okay.
Your feet are pointed forward as they normally are. And I want you to feel what that feels like.
Okay. This is normal.
Yeah, that's your normal. And I want you to note the tension in your body, in your legs. Now turn your feet out.
Back here.
Yes, turn your feet out a little bit. And you'll notice that it's a little bit easier to soften your knees.
Yes.
All right. Because now you've unlocked your system. Now turn the feet back to normal again. And you'll feel that your knees are almost forced backwards.
Oh, yes, it's painful.
Yes. Do you see what I'm talking about?
Totally.
All right. So you've been walking, and this is common. A lot of people we're socialized to believe that our feet should be pointed forward, and they are not. They should be pointed according to the shapes of our thighs.
I didn't know that.
Most people don't. So this is why likely the tape didn't work, because your thigh bones are trying to rotate your feet out already. And the tape was doing that, but you didn't make your feet point out the way that your thigh bones are supposed to point out. So let's go ahead and take off the tape. And let's just experiment with just this next week, walking with your feet out. And you're going to experiment with, I don't know how many degrees it needs to be turned out, but you're going to play around with that. Whatever feels best.
Okay.
Okay. When you stand up from chairs, I want your feet spread apart and your knees pointed out when you stand up.
Okay.
And let's see if that takes away some of that jolting pain that you just experienced getting up from your kitchen chair.
Okay.
Sound good?
Yes. Thank you. It's really, really helpful.
Well, it hasn't been so far, but we'll find out. Thanks for asking.
Let me, is this something like the fact that the knee is like this instead of like this? Is this something that with exercise, the bone can be pulled up, or that's just the way it is?
Well, I'm assuming that it could be a little bit combination of both. We don't know yet. The only way we'd really know is if you turn your feet out and your knees and feet and everything feels a lot better.
Yeah.
And you do that for a couple months and it's feeling great, then go back and get another x-ray.
Okay.
And then say, if it's the same, that has nothing to do with your pain then.
Okay.
Right? Or the shape of your femurs.
Okay. Great.
It's just because what I'm going to guess, Christina, is that over time, because you've been walking like this, you've developed abnormal stress into your joints, and your body responds to abnormal stress by laying down more tissue. In the knee, it lays down more bone and becomes arthritic. And that may be why the joint spaces have shortened. All right. I don't know. We'll find out soon.
Okay. Thank you so much, Rick. I really appreciate it.
Oh, my pleasure, Christina. Thanks for showing up.
Okay. See you next time.
All right. Bye-bye.
All right, Rick, we don't have another person with their hand up at the moment.
Oh, okay. So, all right. So let me read this question here for this woman, Kelly. Let's see. I have a cranky left shoulder. Orthodoc believes it's biceps tendonitis. This is your biceps muscle, and the tendonitis is usually up here in the shoulder. She had a cortisone shot, but it didn't make any difference. And the doctor just said, time will fix it. Well, that was back in December. Nothing's changed. Putting on daily tasks using her arm kills her. She's been going to a PT. Nothing's helping. So she's wondering what else she can do. This started when she raised her arms up overhead. And that was a big clue for me. So there's two clues in here. And this is hopefully will help you all think about your own issues. So when a doctor shoots a cortisone shot into an area that they think is causing pain and it doesn't work, it usually means one of two things. It's the wrong place. That's not the place that's generating the pain. Or two, there's a significant tear going on that the cortisone shot can't overcome, because all it is an anti-inflammatory medication. All right. So if she had a major tear in that biceps tendon, I'm assuming the orthopedic doctor would have picked that up in their exam. So I'm assuming that that's not the location of what's actually causing her pain. So the second clue in here is that this started after she raised her arms up overhead. So raising the arms up overhead can be a dangerous thing for a lot of people. And the reason being is that a lot of people's shoulder blades don't raise when the arms are raising. And I'll just show you right here. Here's the shoulder blade. You can see it's a big, broad, flat bone. Its job is to assist the arm when it moves overhead. The way it does that is it rotates out 60 degrees, it elevates a few vertebral levels, and then it slides out away from the spine. Most people that I see with chronic, shoulder pain or neck pain, this shoulder blade isn't moving well. So what happens is that the arm is moving up, and you can see right here, it just bumps up into the outer bone of the shoulder and irritates or causes a small tear or something like that in the shoulder, and boom, you have pain. The fact that it hasn't been solved in so long means that this is, to me, more evidence, because almost no one understands really how the shoulder blade works and how to fix it. So what they do is they focus just on the shoulder joint, and they might massage around here and things like that, but no one's fixing the shoulder blade system. And so if that isn't fixed, then anytime you raise your arm, you're going to be bumping into that already inflamed and irritated tissue. So my guess, Kelly, is that you need to, okay. So in my Fixing You program for headaches, I have a technique in there for practitioners to show them how to mobilize the shoulder blade to move it and get it moving again. And then I also have taping techniques that will unload the shoulder joint system for you. One of those tapes the shoulder blade up into a better position. The second one unloads the other possible muscle that's causing this problem, which is the rotator cuff muscle. So what I would do, Kelly, is do both of those taping techniques, see if that solves your shoulder pain, keep the tape on for a week or two, let it all calm down, then take the tape off and start doing the other exercises in the program once this has cooled down a little bit. That would be my general recommendation. But I think that's if you were coming in here, this would be my first suspicion, is that your shoulder blade isn't working well. You're bumping up prematurely into the bony roof of your shoulder. The pain hasn't gone away because you haven't fixed the shoulder blade yet. And I would tape you to get you immediately out of pain and give some breathing room to this area so it cools off. So hopefully that helps you all think about cortisone shots a little bit differently and how to interpret them. And then also to think about clues as to why you're having pain. Hers, it was when she raised her arms up. Almost invariably, most people don't use their shoulder blades when they raise their arms up, especially when it's two arms at the same time. So I hope that helps, Kelly. All right.
I have someone from a 717 area code. They unmuted themselves, but I haven't heard anything from them yet.
Okay, 717.
Sandy?
Sandy?
Is that me?
Yes,
sure.
Okay, hi.
Hi, Sandy. Is it Sandy?
Yes.
Okay.
I started with your foot exercises a few months ago.
Mhm.
I had an accident maybe 35 years ago. And so one of my questions is, I think that this is helping. I won't know until I go back to, I work seasonal work, and that's where I have the most problems. So when I go back, I'll see how much difference this is making. I know my back feels nicer. But my question is, when you have an injury, my husband and I actually both deal with this, that hasn't healed properly. Is there still hope without surgery to be pain-free at all times?
Is that the end of your question, Sandy?
Yes.
Okay.
In other words, am I inevitably gonna be dealing with pain as long as I have something that hasn't healed properly, or is there hope that I can eliminate all pain?
Yeah, there is definitely hope as far as I'm concerned. And
Okay.
here's the thing about healing. So if you take a hammer and hit your thumb and wonder when it's going to stop hurting, and we can shoot that thumb with cortisone and we can put Band-Aids on it or even put a cast on it. But as long as you're hammering that thumb, it's never going to stop hurting. But if we stop that hammering from happening, your body will take over healing. Your body is an amazing healing machine. All right. All we have to do is figure out, it's telling us something. Pain is telling us that there's a problem that you haven't figured out yet. If you can eliminate that mechanical stressor to your body, whatever that is, often with chronic issues, this is why I specialize more in chronic issues. It's a more complicated systemic problem going on rather than just one or two things. It's a whole way of being. All right. It's a whole way how you walk, how you're bending, all sorts of things. And so, the fact that you're still having pain means that you haven't hit the right thing. But when you do, Sandy, I see it all the time. People feel better even with 20, 30 years of pain. It doesn't matter how long you've had pain, because what all that's telling us is that in 30 years, you haven't figured it out yet. But when we take away those blocks that are hammering you, your body's natural healing, because if you cut your skin now, it still heals. If you break a bone, it still heals, right? So your body has the capacity in it already to heal if we can remove whatever issue it is that's causing it to be painful, which you haven't figured out yet.
Okay. Well, taping definitely makes it feel nicer.
I'm sorry?
I just said taping definitely makes things feel better.
Yes.
I'm just really glad to know about that.
Okay. So the taping, this is why I emphasize taping so much, is because we are so caught in our dysfunctional patterns of movement and the tightnesses or the weaknesses that have occurred because of those dysfunctional patterns. The tape is a way for us to bridge, to fix, to see what it would feel like if everything was working better. The tape gives us that window to say, oh, when I tape my arches up, my back feels a lot better, or my knee, or my hip, or my feet, or whatever. Or when I tape the shoulder, gosh, all my pain goes away. Well, that tells us that, okay, we got to fix your shoulder. And okay, your feet are a big part of your back pain. So we got to solve that. So I'm glad that you say that the tape helps you, because it's telling us that, oh gosh, if we can, that means that we can figure this out. If the tape can help solve a problem, then you can solve that problem. I hope that gives you hope about, and a way to think about what you're doing. Think of the tape as a bridge. It's showing you where you should be focusing.
Well, and there's an added bonus that I want to thank you for. My thighs have always been my spot that bother me. And I have realized that I don't really use my glutes unless I'm forced to. And so you're helping me tone that one spot that's annoying. So I am noticing a difference.
Oh,
with
great.
That too. So
great. Yeah. I'll tell you, this is what I've learned. So I figured a lot of this stuff out while I was working out of my home and seeing people out of my home. And then I bought this clinic and I saw a huge volume of people. And once I started seeing a huge volume of people, then I started seeing the patterns that almost everyone seemed to be falling into, and then why those patterns were occurring. And so the glutes are central to back, sciatic, hip, knee, and foot pain, even neck and shoulder pain. but most directly to those other ones. So you won't go wrong, Sandy, working on those butt muscles. So keep going on those butt muscles. They're critical.
All right.
All right,
Well,
good.
thank you I'm glad to be learning what you're indirectly teaching me. So,
Oh, sure. Yeah, my pleasure. And, come back anytime. I'll help you as much as I possibly can.
okay. I appreciate that.
All right, Sandy. Thanks for talking.
Thanks.
All right, Rick,
Okay.
at the moment, we don't have anybody else with their hand raised.
Okay, so I want to talk to you guys about a couple patients I've seen with this is another common problem that I haven't talked about yet. These people have, of course, chronic pain in various parts of their bodies. And of course, we can figure out the mechanics of why they're having pain, and we can solve all those. But what's happening is that the pain keeps returning, even when we fix the mechanics of it. And this is a real important thing to understand about chronic pain, is that the thing that both of these people have in common is that they are both very strong, athletic, type A, moving. What do I need to do now? Give me some strengthening exercise so I can fix it. One is an ex-military person who believes that strengthening is the key to everything. The other is just a woman who is just in great shape, and she's just type A and stressed out. And, you just can't get either of these people to relax. They're constantly contracting their bodies. And so this kind of feeds into what I was talking about before with Sandy, is that we have these mechanical dysfunctions and they occur in patterns in the body. And the battery that's feeding those patterns of dysfunction is coming from our brain. We have to learn how to relax our nervous systems so that they're not supercharged up, causing these patterns of dysfunction to recur in the body. So I will be working I have a technique to calm down their nervous systems. We're going to try that and see how that works for them. But I can almost get, and both of them. So if any of you have bought any of my programs, in the bonus sections, you'll see that I have Semantics Lessons. All right. These are audio lessons that are designed to reduce tension in the body and patterns of dysfunction. They're so powerful, especially if you're in a lot of pain and can't seem to do much. Start with the semantics, because they are going to start to unlock your body, and you'll start to learn a lot about how your body moves or doesn't move. But anyway, interestingly, I've given these somatic lessons to both of these patients, and they are resistant to doing it because it's not doing what they think, what their brain thinks they need. They think they need more strengthening. And I keep telling them, no, you're plenty strong. You need to relax your nervous system and calm down. So, this is a hidden force that's working on a lot of people, especially people who carry a lot of stress, who are anxious, people who are depressed, maybe have some emotional trauma in their lives, psychological trauma, spiritual trauma, all that kind of stuff gets held on by the body, and it is expressed in patterns of dysfunction that you've already set up through how you use your body, and that are then magnified by this tension system. I hope so. Those of you who are feeling stuck, and if any of that kind of stuff sounds like you, type A, stressed, anxious, emotional trauma, things like that, then think that these somatics lessons would be hugely helpful for you to begin unlocking your pain. It's the first step to discovering your body again and not letting this tension govern your movements any longer. We've got to unlock that. All right. So having gone on that little soapbox, does anyone have any questions about that in particular? Sorry to go down that, but it's such I just see it so often, and it's what's keeping people stuck. Okay, so let's see. We got a few minutes left. So what I have something else that came up in another webinar, and I wanted to talk a little bit about scoliosis. because people will come back from an X-ray and they've been told that they have scoliosis. And a lot of them see it as a death sentence. Like, oh my gosh, I might as well just give up. I've got scoliosis. Well, there's something that you need to know about scoliosis. So there's a congenital scoliosis that you're born with, and then there's a functional scoliosis that occurs. Now, it's important to know scoliosis only means lateral curve. All right, that's all it means. So if you have an X-ray and your hip is higher than the other side, that means that you now have a lateral curve. And so that will be documented as scoliosis in your spine. It has nothing to do with what you think scoliosis is, which is that S curve that you're born with. So first and foremost, know that scoliosis, and this is easily corrected, all right, these lateral curves in the body, because look, your muscles are the guy wires that are pulling everything into and out of place. So we help a lot of people with both congenital and functional scoliosis because we understand how these guy wires work, all right? And anyway, so, scoliosis, so if you're told that you have scoliosis and that's the reason you're having back pain or SI joint pain or sciatic pain or something like that, well, maybe there's a correlation there, but it may actually not be the cause. What may be the cause is what is causing the scoliosis to occur. All right. So for instance, if this hip is higher and we have a rib cage lower, that's called this is the right side of the skeleton. So this is a right side bending problem. The reason, and this would be identified as scoliosis. The reason this pattern is occurring is because of some dysfunction in the right leg. Okay. So this is the body's way of getting off that leg because it hurts. Something's wrong there and it doesn't like walking on it. So, let's see, Christina, I wouldn't be surprised if you have a right side bending problem that because of your right knee hurting more than your left. And because of that arthritic or joint change here, I would be very curious if your right hip is elevated and your right rib cage is depressed. So if you have right-sided back pain or low back pain or sciatic pain down that leg too, that might be a result of your body's getting off of that leg and then causing neurological symptoms down the leg or some other kind of problem. I don't know whether you have that, but it wouldn't surprise me because when we see a big change from one side to the other, usually some type of side bending problem is occurring. All right. So congenital scoliosis is scoliosis you're born with. And typically that is an S curve in the body, in the spine like this. What typically happens with that, and this can give a lot of shoulder and neck issues, is that the rib cage becomes a little funky. And there forms something called a rib hump. And what happens is this, you can see the shoulder blade is kind of resting on the rib cage. What happens is the shoulder blade then gets hung up on this rib hump here. And people will either get stuck on one side of it or the other, and it causes different types of problems. Well, I haven't had success in changing the rib hump, but I've had lots of success changing the orientation of the rib cage and then changing and then fixing the shoulder blade issues so that the person knows what they're doing and how to solve that if that's occurring. And we loosen that up, or we'll tape up the shoulder blade and get it off that rib hump and all that kind of stuff. So scoliosis is an interesting thing in medicine. It just means lateral curve. It could just be a simple curve like this. It doesn't mean that you have this, big S curve in your body. The person who asked this question in the other webinar said that when she turned 50, her scoliosis became worse. Well, that tells us that she can change her scoliosis. There's nothing magical about turning 50 that would cause her scoliosis to occur. It's just because her posture pattern or her usage pattern may have changed, or there's a dysfunction that she's had that's led to the scoliosis in the first place that then became weaker and weaker, and she finally just collapsed into it. So for those of you who have been told you have scoliosis, I hope this gives you hope. And also there's another method called the Schroth method, SCHROTH. That method specializes in scoliosis, And that more congenital scoliosis, the severe S-curve stuff that you see, they're very successful at solving that. We are not trained in the Schroth method. These are just techniques that I've learned over the years that correct scoliosis. They may be similar, I don't know. But anyway, if you have severe scoliosis or congenital scoliosis, seek out a Schroth method practitioner to help you, or a fixing you method practitioner. Anyway, that's scoliosis. All right. Any questions about that? Nope.
Not right now. No, I don't see anybody.
Okay. So I want to, if you don't mind, I have so many things I like to talk about. Another one is leg length discrepancies. They're, for the most part, a myth. And I want to explain what's going on with leg length discrepancies. First of all, has anyone on this call, I don't want to go down this road if anyone hasn't been told that they have a leg length discrepancy. Has anyone on this Q&A been told that they have a leg length discrepancy? If not, I won't talk about it. Okay, it doesn't look like anyone's raising their hand, so I'm not going to talk about leg length discrepancies other than to say they don't truly exist. All right, it's a functional problem, not an anatomical problem in probably 99% of the people. Okay, all right. So the last thing I wanted to talk about was a lot of people that I see in the clinic have unilateral pain on one side of the body. They may have left foot pain or left knee pain and left hip pain and left shoulder pain and left neck pain. And all of their pain is on their left side of their body. And they say, oh, my body's just falling apart. Well, there's a reason. I want to show you how all of that is connected really quickly here. Okay. So if you have a flat foot, all right, what happens, I'll turn this guy this way. If you have a flat foot, what happens is when that foot collapses, the knee tends to collapse inward like this. All right. And then because the knee collapses inward, oftentimes the hip will then drop down, or some tightness will develop in the thigh muscle and in response to that knee collapse inward. So the foot flattening can cause knee pain, of course, but also because the knee has come in, it can also cause hip joint pain because the hip joint doesn't like to be like this. It wants to be like this. And so it could cause hip joint pain. It can cause muscles to turn on and off. The pelvis can fall forward like this. If the pelvis tilts forward like this, what the body unconsciously does is it starts to hike up that pelvis to try and make it level with the other side. Well, the same muscles that are hiking up that pelvis will pull down that rib cage. And so now the rib cage is pulled down while the hip is hiked up. Okay. Well, guess what? The shoulder blade rests on the rib cage. So now the shoulder blade is dysfunctional because the rib cage is down, because the pelvis is dropped down and being held up by those muscles, because the foot is flat. All right. And then there are connections from the shoulder blade into the cervical spine and the base of the skull. So if the shoulder blade is not working well, then this whole system then is stressed. That goes into the neck and head, causing headaches, neck pain, migraines, all sorts of things. Or because the shoulder blade is dysfunctional, it will cause then shoulder pain issues because now it's not moving correctly and the shoulder will prematurely bump up into bones and things like that it shouldn't be. So if you have unilateral pain on all one side of your body, it's all connected. And this is what I feel is missing in most physical therapy and medicine in general, is that we're not looking at things from a system and how everything is connected. We're looking at things from a component standpoint. So, they would look at your neck pain and say, oh, let's fix your neck then. But that's not where it's coming from. It may be coming from the pelvis or the rib cage or some other place. But a lot of us are not trained like that. So, and this goes back to Sandy's question. I've had pain forever. Am I broken? Basically, is her question. No, because I understand how the practitioners are looking at your body. And it's a limited way of looking at the body. They're not looking big enough. They haven't been trained in how to see everything as a system and how it all works together. It's so much simpler. than everyone thinks. It's not that hard. Believe me, if I can figure it out and use it, anyone can. So it's almost as simple as I just showed you. All right. So I say this because I don't want people to lose heart that because they have chronic pain that they're broken. You are not broken. You are a prisoner of how your practitioners believe they should be solving your pain, which is often limited and not expansive enough. It's not your fault. So anyway, I'll get off my soapbox about that one too. It's a big deal to me. It's frustrating for me because I see so many patients coming into this clinic with chronic issues who I don't know, someone was on here before. I've been to Jeannie, I think it was. I've been to lots of practitioners and so forth. Gosh, we hear that all the time. And their pain is solved because we understand the system. So don't give up. You can do this. There is an answer. Okay. That's all I have to say, unless there's any other specific questions someone has. Go ahead, Christina.
I have a question that maybe this is obvious from your videos, but to me, I don't understand it. Like when we practice the walk, that's supposed to activate our butt muscles. Is the butt supposed to be activated on the side where the leg is pushing off, or on the side where the foot is landing?
The side where the foot is landing.
So, in other words, that makes you sway a little bit, correct?
You can sway a little bit. It doesn't make me sway, but you're welcome to sway as much as you want.
Okay.
Yeah. So in that video, if you remember, one of the techniques to teach you that is walking on your tiptoes.
That's not in the video, but you mentioned it last time. I remember.
What about the ice skating walk then, where you're kind of ice skating? Okay.
Mm-hmm.
If you do that ice skating walk, you'll feel that butt is turning on the leg that's advancing.
Okay. I've been doing it wrong, but I'm going to change.
Yeah. So because that butt has to be there to catch you, right? That butt is the thing that's holding up that leg to catch you from when you're advancing onto that leg.
Oh, okay. Okay.
If your knee is locked and you've turned off that butt, nothing's there to catch you other than your knee joint.
Now I understand. Okay.
Yeah. Thanks.
Thank
Great
you.
question.
Yeah.
All right. Okay. Well, I guess that's all. That's it, everyone. And thank you for joining me. We'll be doing more of these. So, if you do have questions, join and ask your questions, and hopefully we'll help you. Everyone have a good night.
Thank you very much.
Yeah.
All right. Good night, everyone.